Camzyos is a prescription medicine used to treat adults with symptomatic obstructive hypertrophic cardiomyopathy. Camzyos may improve your symptoms and your ability to be active. How to use. Take Camzyos capsules exactly as your healthcare provider tells you to take it. Don't change the dose without talking to your healthcare provider first. Take Camzyos once a day. Swallow the capsule whole, do not break, open, or chew the capsule. If you miss a dose, take it as soon as possible and take your next dosage at your regularly scheduled time the next day. Don't take 2 doses on the same day to make up for your missed dose. Your healthcare provider may change your dose, temporarily stop, or permanently stop your treatment if you have certain side effects. If you take too much or overdose, call a healthcare provider or go to the nearest hospital emergency room right away. Use adult dose for hypertrophic cardiomyopathy. Recommended starting dose is 5 mg once daily without regard to food. Allowable subsequent doses with titration are 2.5, 5, 10, or 15 mg once daily. Contraindications. Don't use Camzyos if you are allergic to milk content or any of the ingredients. Always check the ingredients to make sure you can use this medicine. During treatment, you may be at risk of developing certain side effects. It is important to understand this risk and how to monitor for them. Don't take Camzyos during pregnancy and for at least 4 months before getting pregnant. It is not known if Camzyos passes through breast milk. Talk to a doctor if you are breastfeeding or intend to breastfeed. Warnings. Camzyos reduces systolic contraction and can cause heart failure or totally block ventricular function. Patients who experience a serious intercurrent illness, such as serious infarction or arrhythmia, arterial fibrillation, or other uncontrolled arrhythmia, are at greater risk of developing systolic dysfunction and heart failure. Before and during treatment, tell a healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking Camzyos with certain medicines or grapefruit juice may cause heart failure. Do not stop or change the dose of a medicine or start any medicine without telling your healthcare provider. Especially tell a healthcare provider if you take over-the-counter medicines such as omeprazole, Prilosec, esomeprazole, Nexium, or cimetidine for Tegamet. Take other medicines to treat your obstructive HCM disease, develop an infection. Side effects. Camzyos may cause serious side effects, including heart failure, a condition where the heart cannot pump with enough force. Heart failure is a serious condition that can lead to death. Tell a healthcare provider or get medical help right away if you develop any or worsening, shortness of breath, chest pain, fatigue, swelling in your legs, a racing sensation in your heart, palpitations, rapid weight gain. The risk of heart failure is also increased with Camzyos taken with certain other medicines. Tell a healthcare provider about the medicines you take, both prescribed and obtained over the counter, before and during treatment.